Hello, everyone. Very happy to have another young Indian with us, part of the voice of the young. Right now, we have with us Girish Patil. Let's listen to him. Over to you, Girish.
First of all, thank you, sir, for giving me this opportunity. As my name is Girish, and I am currently doing masters in survey research and data analytics from International Institute for Population Sciences in second year. In graduation, I did graduation in statistics. After all, my uh, focus is to use real data, to work on real data, not on like company or company. I am not chosen company to go, so I prefer a survey, a master's degree from IIPS to do. uh, my course is related to large scale surveys, their analysis, and how the policies and data will be used for policy making, and like National Family Health Survey, longitudinal aging survey. The IIPS is working on data collection and demographic analysis.
Yeah, go ahead.
Yes, sir.
Yeah, go ahead.
Basically, the data we can see in today's world that if you search in any data issues, or what is the use of data, if you see in mobile phone or anything, if you search about mobile phones, or if you search in about bikes in Google, then other apps are showing the ads related to bikes. What you want is more, your data is analyzed by the mobile apps, and then they give preference, add preference to your mobile phones. So data is, in today's world, data is very important to for progress. And in when when it is a clear example how effectively data can be used in today's digital world, like in we can see in COVID pandemic, using data decisions such as many vaccines to provide, how much oxygen to supply the districts, and how many hospital beds to arrange were all based on available data sets. This shows how crucial data is for effective planning and resource allocation. Data availability and data use is very important for a democratic nation to see how the problems are in society, what are the future problems maybe arise. Like in today's world, aging population is rising, so in future government have to decide where to allocate the money, either in primary healthcare services, for child immunization, or government have to use this money in old aging homes. So data is very important for policy making and future allocation of resources. Data used is also important in researchers like advisors uh, uh, in many government institutions use the data to identify areas where we have to focus. This helps to formulating policies are both sustainable and effective in terms of cost and time. The International Institute for Population Sciences dedicated to training and research in population studies. It trains demographers and promotes demographic sensitivity and understanding of the size, composition, distribution of the population. Our institute basically has studies in course. It focuses on key issues such as population aging, demographic transition, and demographic dividend. Dividend means how the working age population in today's, it is a demographic dividend phase we are in, which is started from 2005 6 to until 2055 to 56. It will there. So how government should utilize demographic dividend basically is working age population, where to industrialization, focused on more on industrialization. uh, so how the employment rate, basically it is not in a sense that government use this demographic dividend. Indicators are used to evaluate, monitor situations, and to understand future trends like happiness index, labor force participation rate. How many indicators are not comparable, or some of them are comparable, or erroneous also there. So, in our course, we basically focused on the institute is focused on how the indicators should basically used for comparability, future policy makings, how they are used, and for this data quality is very essential for survey design, coverage, and how the data is combined or separated. The institute trains students to help and develop holistic understanding of population and development, considering aspects such as sustainability, effective and how efficiency is this, and equity of the policies, such as inclusion of all societies. In policy making, high quality data plays a vital role in creating effective. For example, in NFHS started from 1992 to 1992 until it is running. Using this data, researchers find out that institutional deliveries reduces the infant mortality rate. So after this research, government decided, or policy makers are decided to uh, institutional to promote institutional deliveries. So government provides incentives to 2 months for institutional deliveries. As a result, the infant mortality rate will decreases. This kind of issues were solved using data based on the findings. Similarly, for the aging also, where whether to prioritize nursing homes or primary schools. As a statistics graduate studying surveys as the NFHS, the LASI data, tobacco, global adult tobacco survey with valuable practical exposure for me. I learn about their sampling procedures that represent the population, the data collection methods, method use, and how issues like non-response and missing values are addressed. Like if the layman using the data in today's situation, if a layman is using NFHS data, he will not understand where to there is also where to use, how to analyze the data. But as a IIPS student, uh, or a training based on that, we can there is a some errors. So there is also cleaning of data if there is missing values in it. So data we have to also prioritize the privacy of the people's and uh, uh, as I worked previously in global adult tobacco survey as a field investigator. In this area, my experience is as for data collection, enumerators who collect the data in field, which perform a very well role to. It is very important. Their training is very important to collecting the data. As, as a field investigator in GATS, I realized that in rapport building with the population, with villagers, is respondents is very essential for the quality data to collect. There are if there is also taking a consent for participation of the respondents. If the if rapport building is not properly, then uh, respondents may answer not properly. So rapport building is very necessary for collecting data, and their robust training is very essential. In rural areas, I also observed that people often use during adult tobacco survey. In internship period, I did this uh, got an opportunity to work as a pre-testing for global adult tobacco survey. I found that people using a tobacco as a tooth is to brushing the tooth, because they don't have the primary healthcare facilities. And also, instead of using primary healthcare facilities, they using a tobacco. So new insights are find out using the data. In India, data on migration and birth registration are often incomplete. While registration is mandatory in some states, others still lack proper implementation. Detailed data in the district, village, or block level are often unavailable in many cases. Only state level reports are available. Using this, if the district level data we don't have, then how the decentralization or future policies will be work. The Civil Registration Act in 1969, which mandates compulsory registration of births and dates, but dates are not registration. We don't have proper mortality data. India lacks in it. Do birth registration we have due to the birth certificates, but death registration is very less. So data is very lack in this. One of our professor told during the lecture told that he demanded a data research center which to government which works as uh, different data sets like migration data from tickets, government various sectors. His intention is to merge the data sets and work on it, to tackle the problem of data unavailability. But government refuses to this proposal. As a researcher or master students, I also government is not focusing on with the researchers find out in policy making. The researchers' role are very less in researchers doing the research, but government is not taking that seriously or not used in, or policy advisors are not using this in. Uh, Before the statistics graduated, my intention is to, or my focus is to join UPSC, Indian Statistical Services. But also, professor told that, and my senior told, as a Indian Statistical Service, their role is to advise the government to where the policy should frame. And the advisors are advising the government, but policy framing or policy to come policy, it is a depend on the politicians. So as a policy advisor, it is difficult for doing the best policies to come. As we consider actual contribution of individual to the workforce, like periodic labor force participation, there are indicators but which are not comparable or erroneous. So availability of data depends on how the data user will use this, like a happiness index which is not comparable in the countries, but till it is calculated. And also periodic labor force, it is a manipulating type. If in now situation, if the someone get labor or someone is employed, then he also calculated in labor as a labor. But what about his labor work, or how many days he contributed for the labor force participation? So it is a manipulating. Also, data can be manipulated easily, but it is training is essential for how to frame the indicators, how they will comparable, and how they will use for policy making. Like if we take example of two villages having the land, farmers having the land. We can, if the motive of the calculating farmers land some person, then he will use average land having the farmers. But if the data is skewed, or in other village, there are two villages, suppose in B village, the data, some farmers have more land and some farmers have less land, and second village have the average is same. I mean, all have the same land, but we can't see the first village have the inequality in between lands if we not calculated median land having them. If we calculated average land by farmers, then it is not, we can't see easily the inequality between land having the farmers. So it is very crucial to use best indicator for calculating the calculating the lands of or other things. Uh, as in previously second my internship I did in Abhijit's in rural internship, where my experience is that my research question is how women utilize money and how their empowerment, how they uses economic resources within self-help groups like Ujwala scheme. Before the field work, before going to the field, I studied 12 villages collecting data, primary collected data. And before the going to field, I means I read newspapers or in the news. I also often there are schemes, government spending this amount, thousands of crores to these schemes and these schemes. But my question is why the villages are not performing well. So after doing field work and primary collecting data about Ujwala scheme, uh, the in village there are the households which having two cylinders in within households, and those households are essential or vulnerable households. They don't have Ujwala scheme or any other scheme. So basically, the government spending money for progress of the society, but in if we go to village, the policies are not in implementing, or we can't see it is work, because in a village the policy implementer is sarpanch. So first of all, he implemented the policy with his relatives or with his uh, circle. Then after those households are needed, they left or they don't have the cylinders, and also those have beneficiaries of the scheme, they are not refilling the cylinders due to their less availability of money and irregular income. That's why they are not refilling the cylinders. Moreover, the households are truly need such schemes, especially the vulnerable ones often remain excluded, while some relatively well-off families receives multiple benefits within the same households. And similar for the they don't have documents. They don't have Aadhaar card in some households. Similar issue exists in agriculture sector also. To avail the minimum support price, farmers must first register their crops and then wait for a long quiz, sometimes up to 4 or 5 months to sell them. For poor farmers who need immediate income or immediate cash after harvest, often sell their crops to local vendors at the lowest price, and then local vendors sell this price or store. First of all, they store and then sell similar to minimum support price under a government scheme. So the profit of the minimum support price is goes to the vendors. So uh, vulnerable, those who need such schemes, they are not get the schemes, but the others are getting the scheme. So vulnerable make a more vulnerable in this sense. I also studied the self-help groups in 12 villages. There are there are the individually get funds but still not starting businesses as a self-help group. Some self-help groups performing well, but not others. Like for widowed population, they don't have childless population. They using self-help group funds for kirana shop, or they sell vegetables using this loan, but not not properly as functioning, because similar type of businesses like women starting in one village at 200 number of households in village, very less populated. In this household, only in this village, only one kirana shop or atta chakki shop will run, but a two three women similar type of businesses started, so they are not sustain their businesses, or they stops the businesses. And self-help groups uh, funds in ground in villages as substitute for ineffective welfare schemes due to like for farmers in harvesting season they need a loan. So due to poor credit score, banks are reluctant to provide loans for agriculture, so they use self-help group loans. If the banks will provide the loan, then they will use self-help group loan uh, for starting businesses, but they not started businesses. Like also in Pradhan Mantri Awas Yojana, not timely sufficient funds, so they use self-help group loan for constructing the house and also for medical emergencies and children's education. In the among four villages, they are forest area. There is so due to hilly region, there is no primary health care or buses marketing. Public buses are come only for school days for picking and dropping for the students. So there are also a lack of market issue in that villages, and lack of there is some villagers using self-help group loans directly started businesses like purchasing a khawa making machine or paneer making machine without having the training. And also, one organization from Pune had provided training for making organic compost, incense sticks, and cow urine based products, but they not started with the businesses as women are very means they don't know how to proceed with the further. They are very means to use the money. Either money will get means not properly used or business not properly run. They have the funds, but they not able to start the businesses. Uh, so the self-help group loan is not effective. Means they have the loan, but not they. Started businesses. And also women also one help self-help group started a businesses of shoe and chappal making, but their sales limited to the village and the businesses had to shut down within few months as due to limited market access. And also poor water availability and power shortages there. Women spend several hours collecting water. Much of their time is spent in fetching water. As a result, they find it challenging to get involved in self-help group activities or dedicate time to starting a businesses. And one woman from village, there is pastoral communities in the other villages. So they use milk. They have the milk. They used milk for making paneer and khawa for hotel supply. But they face a significant challenges due to frequent power cuts and poor transport facilities. These issues lead to delays and product spoilage. And as discussed, other issues like limited market, limited training. They don't have primary health care services, so they using self-help group loan for that consumption. Also they using for education, children's education. So this leads to next factor, which is preference for money lending over businesses. Like self-help group members take loan from their group at low interest rate, and then this gives this money to other people at higher interest rate to earn a profit, like a modern money lending type. And if as a result, if they using this money for consumption and consumption pattern and household, so they are not able to return or not able to return the money to banks. So this leads to a loan dependency and debt cycles in self-help groups. Using self-help group funds for agriculture and also due to changing climatic condition, instead of repaying the loan, they often take another loan from different self-help group, and it creating a vicious cycles of debt where money keeps circulating as loans without generating a sustainable income. So it is more found in the villages. Also, in some households, just left the villages due to debt cycles among it. In one case, a woman from Bivapur village got stuck in loan cycle. Her family had to pay more interest each month than they earned. So I realized after fieldwork why decentralization or India should focus on decentralization. Among the 12 villages, Some the out of 12 villages, 5 villages have pastoral communities. So I also asked using questions about Manrega and how they work in Manrega. Although some of respondents said that they work the Manrega, but they don't know what they work. And some of them said that they planting a trees. I got confused, or it is a forest area. So why they planting trees? Means there should be a decentralization process where they should sarpanch or they should realize where they have to invest this labor force, either to community gardens or other things. Like also, I asked questions about Ladki Bahin Yojana scheme. In this scheme, 1,500 is given to the beneficiaries, like women who are the beneficiaries, 1,500 per month. And the government motive is to give supporting for medical services and educational needs households, and women's decision making will increase after giving this 1,500 money to women. But in ground reality there is no such type of, in 1,500 it is not possible in today's expensive world. uh, they often not refilling the cylinders. In one in other side, government giving 1,500, but cylinder price is also increasing. And instead of doing the primary healthcare services, government spending a 1,500 rupees for them, which is like not beneficial. Or women often they don't know what the means, they don't know what they do using this money. They often using this money for household consumption, and some of them using this money in self-help. The state often, due to this scheme, the Maharashtra state often borrows funds from central government to run this scheme, which increases financial pressure. Once implemented, it becomes politically difficult for any government to discontinue these schemes. This situation highlights how the culture of free buys can undermine long-term development goals. Instead of questioning the effectiveness of such schemes, many beneficiaries women accept them, and reflecting a deeper concern about functioning and accountability within the democracy. So, my personal views, in China, there is more decentralization as compared to India. So, government spending 1,000 of crores, but it is not implemented in ground properly, not implemented in ground. The system is built up like that. The money is rich people getting more rich, and poor are getting more poor due to this decentralization issue. And also data is also not available, like district wise, village wise. If data is available district wise, then it is easily to resource allocation. Like in Kerala, there is aging population is increasing, and also infant mortality rate is low. But in some districts there is not type of situation. So we can't see, we can give less resources for Kerala and more, giving more resources for Bihar or UP. So decentralization will focused, or resource allocation will be better, and progress will be very better for this. And also we can't say like using data availability. Some of districts, if suppose two districts comparing the crime rates in a district which is strict in crime, or where administration is strong, then they are registering the crime rates, or crime registration is more, and other district crime registration is less. We can't say that other district is better than which is registering more. So availability of data, or kind of estimates we can take from data, it is not similar like that data will give. We have to also check the qualitative study where it is lag. That's,
Thank you, Girish. I mean, you have really put forward a very clear view of the importance of data and the lack of data. And you have also articulated your view that uniform policies actually don't take account of the differences on the ground in India.
yes, sir.
They don't. And this is actually a serious limitation because if you get a national policy, that's not going to work in every state.
Yes, sir.
And within a state, also there are differences across districts, as you rightly
Mm,
pointed out. Some are pastoral communities, some are not. And you try to have the same policy across the state, and it doesn't work. Well,
That's,
you're spending money, but you don't know who is actually controlling the money. You don't know what they're actually doing with the money. And you don't have any data. You don't have the monitoring and evaluation systems in place. And even if you have some, you don't know who's giving what data. And
yes,
it is a mess. I agree with you. Okay. So thank you for that. I do want to talk to you a bit offline. So let's end it here today. And thank you so much for a very clear view of the role of data and the role of actually knowing the ground reality.
yes, sir. And also that I studied among 12 villages in pastoral communities in 1994 census. The census means collector mentioned that it is a milk production area, which is the Denmark of Vidarbha. Vidarbha means in Maharashtra
Yeah,
area.
I know.
But government less focused on these pastoral communities or the milk production. So now in recent days, the cows are going to extinct. So why decentralization means we have the local board panchayati raj system, but they don't focused on this. What is the
I
potential of that
Okay.
villages?
All right. Good. I understand what you're saying. I understand it fully. And actually, I'll talk to you offline about what I'm doing because this is not a forum for me to talk. So let's end it
Yes,
here today. I'll talk to you a little bit offline. And thank you so much for being here. Okay.
thank you, sir.
Really enjoyed listening to you. Okay. Bye bye.
Bye bye.
Stay online. Okay.
Okay.